Nashidelek,
Yesterday,
how was your on-site session today?
today, Shaban Sodonde kind of Chonsa.
So this morning we couldn't have the first session. Like the president arrived this morning, so we couldn't have that in the morning. But we did in the evening for 1 hour.
Yes, very good. And you're all working towards your projects?
Yes.
Yes. As you are thinking about your lesson plans, I want you to be able to have examples of how you can creatively teach neuroscience. So I know I've been reminding you that the Emory Tibet Science Initiative, the ETSI slides and curriculum exist, but I want you to be able to pull together something that's more meaningful for your particular institution. So this morning, I want to start with a little exercise around visual hallucinations. So let me share my screen. Oh, there we go. I will move back and forth between my screen and a video that I'd like to share. So what we'll be doing is we'll be watching a TED Talk or a video. I think you're familiar with TED Talks. We'll be watching a video, and then I will interrupt the video with questions. And I know that you have at your tables your cards for multiple choice questions, A, B, C, D, and you can show your answer when I give you the question. Okay. So what I want you to see from this is that the TED Talk was not prepared as a lesson. It was just a talk that people would find interesting. So yesterday, when I was practicing this, I made my daughter watch it along with me, and then I asked her questions. So you have to make sure you get more questions right than my daughter. Okay. So you'll have patience with me, because in terms of the technology, what I should have done is put this in Google Classroom with the slides, stopping at the right point, but I'm going to make it work by switching between screens.
저기 만나 Google Classroom나 샤데티 고 단다게다 드와티즈 참참 거래 보내 샤자 대요 줄로 주즈나 디디된 바네 티총마 송스탄 발라 단다 니치 대야티로 와데라야 니치 주자기자기자기 땡기 인스티 봤어요 그 주치기 주르게 되네야 지금 야포로 마정 바나 야 지조금 나지 조스나 오치스.
And if we have enough time at the end, I'll show you a video that was made by the Tenzin Gyatso scholars who are at Emory this year and were in my sleep class.
한다 단다 게디 주제 정바이바이나 아니 단다 에머리라야 럼친 섭전 치생 섭전 정 진예기 단전 수생을 전혀 고수고 샤주게 고수 나른게 진짜 아니세 되게 생게 원서 생긴 진짜는 주샤주게 녀치요레스 주제 정바이바이나 티탱기스.
Their video was about sleep and hallucinations, but it's relevant enough that if we have time, I think it would be nice for you to see.
자 고수게 티카레세나 수게 고수조 샤주티 아니 가사니에 땅 아니 주는 거 거레스 디스탄바데탄 데와티시에자 아니 게티타 투반바나 야푸용 그레상기스.
Okay, so this video that we will watch is a TED Talk by Oliver Sacks.
한다 단데 다야기 닌데 수레스나 담시 나닌데 Oliver Sacks 레스.
Oliver Sacks is a very famous neurologist. He's written many books. What's interesting about his books is that people who don't even know science can read it and understand it and enjoy it.
다 Oliver 그런 바이나 단다 왕자기 차이루바다 캐르첨부지 바다 아니 그런 게 가서 그랬다. 뎁티다만 보쌈이요리스. 또 그런 게 뎁티다라야 제취지가 요래서나 내 지금 차이루기 접종시도 매바인바나야 내 지금 뎁티 로바인바나야 주는 용해야 된다 지요리스.
So he's a medical doctor, and so he would write stories about his clinical experiences.
한다 그 실기 암지지 인정로 멤버지 인정 그 가르치요래서나 거기 내 바스고라다 그런 게 특시지색이 수지지색이 특시지색이 네파트즈톤데 비가 론트랭고레스.
So one of my favorite books is a collection of stories, and this one is called The Man Who Mistook His Wife for a Hat.
한다 단데 티나네 징아랑 가시트카린세나 아니 그런 게다 돈치요서 돈다 카르세나 네파트즈고 돈 초드지주지도 티게 뎁티게 밍나야 아니 랑게 정말 샤무실라 좋아.
Another one that I really enjoy is called Awakenings, and that one was made into a movie.
한다 젠다야 지가 사실 젠다 가르고스나 믹제스 awakenings like the 믹제스의 뎁치요레스 대가오요스 대티임바나 아니 델라지시고 로냐요요레스.
So if you're thinking about things to use in your classroom, if your students are able to watch this movie, then you can teach about dopamine, about sleep, and about movement.
한다 게데처럼 단단한 주 배치탄트 요바임바나 네 배치탄트 바이나 단다게 돈에 데탈라테니 데티르바 되게 미제세스토가 되게 돈에 데티데테 그 도파민 땅 아니에 되게 지금 그 추추로와 어때도 안에 소체 지알아야 아니 그 팬트요레스.
So one of the things I find very exciting about Oliver Sacks is that he can take very complicated neuroscience or neurology ideas and make it open for everyone.
한다 그게 지금 연sem비기 콜라 체치치요파카를 세상가 쪽은 역자 차오기다 왕자기 민주당들과 야나 왕자 차리당 데비게 주시 역자 차오디는도 아니 그답 디우즈데 담이 참하게 롱치트 파틴데 주트거레스.
As a graduate student, he became one of my heroes, somebody I would look up to because I thought it was fascinating that he was able to teach without trying to teach.
다 나랑게 다 신지로마도 단다 브랜로피치 캅스 존치 캅스 단다 올리버 인바나 나랑게 카르사 미피타사기다 지인스 카르치라 바인바나 코게 지금 삼친 치야기 답시 당그 요 말에다 이나 인바나 양 코게 지금 락통도 때달라텐데 지금 랑쟁가 나출라 시샤 망포 지금 토병거레스.
So every year since 1991, the Society for Neuroscience has awarded an Education in Neuroscience Award.
단다 치통 그저라 그치고 치네 정도에 다다게 Society for Neuroscience says to the Tandanga to Henrik Tsudi says to Henrik Tsudi, and once that Henrik Shing is on top set in the low region, and then also yours.
And he was the very first winner of this award. And last year, I was the winner of that award.
And the Oliver in Bana, Zantate, Chi, Tomato, Cantilis, and Nana in Bana, and is on talking a lot of songs.
So if you go to the list of awardees, he is at the very bottom because he was the first, and I'm at the top because I am currently this year's awardee.
That get the Chitsuga dig a Tata de Ganson de Tantas on top the Tomigi, Minqueta by Bana, Oliver Deco, Tampo de Tony, Santa that Minjon or a Minjon or the Layores, Nara in Bana, Gangan, the Layores, Kachila Bana, not a niche around the Traveres.
Okay, so without further ado, I will take you to his TED Talk and we'll start listening.
That so Mambo to Latama Gane and Nangasu Lonian Towers.
So share screen. Will this be big enough for you to see? He's just sitting having a conversation. It's not, I want to leave the transcript on the screen in case you're able to read English. It's right here along the way. And so you can see what he's saying as he's saying it. Is this okay? You can see it?
Probably they can receive this transcript. Yes, too small. Ningi shock certela yako that teaches Tambala Timankore Yigla Papshat, but the Tongodo, Chontaji, Pitchet, my copying.
Okay. Okay, I will leave it this way anyway, so we can see it if anything, Dawa.
Sure.
We see with the eyes, but we see with the brain as well. And seeing with the brain is often called imagination.
Dawa, how much should I play before I pause it?
About with this, about like 30 seconds will be fine. I will just look at the transcript and listen and then briefly translate.
Okay. All right. So sorry, I just start again just to make sure we have a good flow. So about 30 seconds would be okay?
Yeah.
We see with the eyes, but we see with the brain as well. And seeing with the brain is often called imagination. And we are familiar with the landscapes of our own imagination, our inscapes. We've lived with them all our lives. But there are also hallucinations as well. And hallucinations are completely different. They don't seem to be of our creation. They don't seem to be under control. They seem to come from the outside and to mimic perception.
Imaginations na tozu samuna chi samuna courage or to say this. Tinstambala didn't know samuna tele tozu chion stambalaya, Nangasu to tozu chiewig and the landscapes of Kopatan Pizunga to Haku Yores, Natsu, some nanga that you to watch a Fonsunga to Haku Yores, Tim Sengato, and Sekanzala date and Yam to a roach young Yores. Even I am. Then the pronounce to hallucination such to pronounce it, and Atsula. Truly, no what yours. The dear capsule pronounce it on Nangasu Tozu said in cha, and the imagination says your Tozu Tincha, Betty Kakaris, that then the pronounce it in Atsu Zusha Juchiomaris, the Missing Atsula Tanzio Pachiomaris, and the core and a young Judy Chalona Young Vacansh Laya, and then Atsugichium, the Shishia like Putsuge, the Lady Jidus.
Okay.
About hallucinations and a particular sort of visual hallucination, which I see among my patients. A few months ago, I got a phone call from a nursing home where I work. They told me that one of their residents, an old lady in her 90s, was seeing things. and they wondered if she'd gone bonkers, or because she was an old lady, whether she'd had a stroke or whether she had Alzheimer's.
다 단당이 디콜라 데시자기 인스와 단다 춘낭기 콜라 데시자 바탕 세계가 속에 통솔게 춘낭치 콜라 데시자기 인스팅하는 게 네팔 타비 캅스 만폴라티 두스 아니 다와 카시치군라 양알라 카퍼치 아니 단다 nga sugen su content do chini ta coverage yung deti nga likachi se gen su content coverage mo deta kar se du se na khusu de la denyi ro ani mo la lu kuchuna na yin chi ke ani chang shindam de la thongo dus istambala ya ani khusu ge se la chi che na mo nyom ba cham dos yamana ani ko la kar su reta lu chenbu gong lu thongbu yin zang yang na trip chung wa ta yamana nga su sai me ge de chuan do chi men do se dus.
Okay. First question. So, in addition to visual hallucinations, what other kinds of hallucinations can we have? You can discuss in your groups and then show me your cards to tell me what your answer is.
Hello, Jillian. I think all the groups are ready with the answers.
Okay, let's see it.
Yeah, in 1, 2, 3. That's all.
Okay, so table 1. I can't see, so you'll have to tell me, what did you say?
Well, most of the table actually are showing D, except there are like 1A. There's only 1A, 1A,
Okay.
and the rest are all D.
Okay, very good. So does the table that says A, would you like to defend your answer or would you like to change your answer?
Tanda e insani damni chorwa ane chitsumete te inse to stekimbe yana chitsuge lenti jujagi bes.
Auditory sound lada sound lada hallucination kharshin resam dana de nganjo samjam ni dra mego dinde code ya ngone gei du sam ina robadan jo mako suzo gi code dinde yora suzo rangi code dinde yora odi
Also because the sound sometimes we hear some sound that other people or our friends and our neighbors don't usually hear. That's why I think there could be auditory or sound hallucination. That's
so A is correct. A is correct. Yes, we can have auditory hallucinations, but why have you not included B or C?
단단하게 에티티버리스 나 솔레 뒤쪽에 주나도 용나를 보여です. 와, 내가 다디 값이 저런 게 B등 C로 와, 저쪽당 샤당 저쪽에 아니 주나다야나 가서 락샤기 주노티 담에 누구 전생가리 베스.
카지나 나랑라 에디 망보 총송 어디시니 에디 담이
Yeah, the A or option A or have more experience with the A, so I chose A.
Very good. So what you can do here is when you ask questions from your students, now the correct answer is D, all of the above. but it just means that you don't know about olfactory hallucinations or tactile hallucinations yet. So here is an opportunity for you and your students to go and learn about smell hallucinations and touch hallucinations.
Handa dada de kapse cherangi chorong la ya nyanyong me ba tela tene dete ani nga su trishat tsur tang rakshagi ani tunang de chomanyong se korwa tin stambala de kapse nga su la khari ku kap chirak ko yores na cherang tang cherang ko lok tu la ya ani chi tma tang yang na nga su ge chi rak parwa ta thu bala tene dete yang tunang chonga chi korwa ti ge kor la ya ani chi tokship chi ya tang ti kor su dup chi ge ku kap chirak yores
So
de
some
kapse tang da len ji ba de ani concept chama se de res.
Okay, good. So some people will actually be able to smell something and it's usually unpleasant, but they just keep smelling it and there's nothing in the environment causing the smell, but they smell something all the time, and that is an olfactory hallucination.
Dami kashi bayana yang ko samla karim gore sena ko korina ya ani chala chime pa bayana ya chiptang gi bayana di kapsa tomati ro tomang yamba tin do reswa chiptang gi ko korina tomati na do chime pa bayana ya ko tapper tomati chor de yagi netang chore di kapsa di kare sena ani nga su chur gi tanda ta tunang de res.
And touch sensations, some people will complain about feeling things crawling on their skin. So they'll think they're animals or insects crawling on their skin.
Tanda nga su ge raksha tang de wa rapa ta de bi ge chna de ga semi khashi ge ko ge zu ko gana ching go de go chu do ro chi ge gana do go chu do nga chung bo tang de na zo ko gana sha ge pa gana do go chu chna de do de shi jak res.
So as a matter of fact, any and all of the senses that we're familiar with can produce hallucinations.
Da tong yu sin ba na nga su tang de we ge ta ti or wa wang bo yor wa da de so wang bo nga su ko da wang bo de ta la ten de nga su la ani chna tin jong res.
So hallucinations happen at the perception level, and any of our senses can contribute to that.
Da nga su chna de ju ge na perceptions na do shi ge ba la jong yu ta ne nga su ge wang sur juli da yung go wa cha ten de lang yu ta wang sur ani tham che la ten ne chna tin jong res.
Do you have any questions about this?
De ko la twa yes.
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 The answer me shara tin yara te so le mi gin tuna de yongwa no se sun tona de gin tuna mi loala.
The visual hallucination happens to blind people.
That's exactly where we're going.
Te tanda nga su tanda ta tanda twa te twa ta na shin tanda nga su di wala tayaris.
That's what this video is about.
Te tanda nyen de ta kara kore twa.
Okay, good. So you got the punchline, but let's listen anyway.
Ta chur nonda do de ra sha kanda nga su de ma kanda rin ta was.
Okay, let's pick up.
Rosalie, the old lady. I went in to see her. It was evident straight away that she was perfectly sane and lucid and of good intelligence, but she'd been very startled and very bewildered because she'd been seeing things. And she told me, the nurses hadn't mentioned this, that she was blind, that she had been completely blind from macular degeneration for 5 years, but now for the last few days she'd been seeing things.
That jela ya ane kusu kasik du sena yongchi de ti ane rosli sig do ta na ge momo de mola de la ya taga yong ro chi sig du stenga chimba ins mo de la te ba ins na ti kap se ko ta ngonsu do bo kare do sena mone pete ko thampo ta samba chi ne ro thampo thangcha che ente ga tele ko namrik sebo temse chi ga ripa imba ma suna tongpo do sro ne ti ta ina yang smola ya ta chi khars ro ha ro chi sa te karisi sha sena mu ge ta jala dram ra chang dram ra tin da thong do mu nga la khar lap son sena ani mo kars re longba yin ta mi ki thome chi shara yin longba yin se son imba na ta ta manshi pat zu go quality korten de she jama son swa ani chigin ba na ta ani nga su ge macular degeneration sin macular side te ro sarthis mukang chashi chi sarthti ani nyamchi chongala tin de ani lunga green la ya ani dus tilatin de ta ani mishara chayo sig dus imba na yanda de begin ma khashi ran la ya mug ani jangwe tin de thungu dus lapsons.
So I said, what sort of things? And she said, people in Eastern dress, in drapes, walking up and down stairs. A man who turns towards me and smiles, but he has huge teeth on one side of his mouth. Animals too. I see a white building, it's snowing, a soft snow. I see this horse with a harness dragging the snow away. Then one night, the scene changes. I see cats and dogs walking towards me. They come to a certain point and then stop. Then it changes again. I see a lot of children. They're walking up and down stairs. They wear bright colors, rose and blue, like Eastern dress. Sometimes she said, before the people come on, she may have...
Sorry. That
was ku kare keche trin sena chorongi kare thong dus keche triba insta mo kar sigat sena ane chi sheshok Eastern school ada sheshok tu lo ko ni tin da wo mi thong dus mi ti thong de ta ane kinza gang la ya dwa ta ma dwa tin da thong dus ne mi chi ane nga sho la ya ka shi ko de ti ane jamdang chite song tan song sim ba na ya ko ge kha ge chok chi la ya su chen bu chi thong song ni shenda samjin socha tinda yang tongdos timse khamba garbu tinda thongson khamba ko yoba tinda thongson khamba betu krata sobsu tinda thongson timse ani ta chi gang tele gachi tri de yoba chiang thongson ani ko ge tanda ni gang khawa de yama dus degidus ani gonda chi la ya ni ti chela gonda chi la ani thoya ge na wat zo jron ro sons ani kari thongdo sena ane karsa shimi da ane ki tinda do ngi shola yung yo patina thongdos thongsons ane ko ngi shola tsongkori sacha kam samchila yung ane tigi jela ya yang samjagdos yung samchagdos ane tigi jela yang ko yangchen jura lo sons ngarang bge mampo thongsons bge mampo thongwa asila ko so yang kenza gang le ya dwa ta ma dwa ane ko su tolo te yang bet korong ta chunta hachang taku segorwa je ngombo ta ta rosu do yozu tinda ani ko shershok tu lo tong chon chan daw yozu tinda to lo tin conscious
seem to go up to the ceiling. So I said, is this like a dream? And she said, no, it's not like a dream. It's like a movie. She said it's got color, it's got motion, but it's completely silent, like a silent movie. And she said, it's a rather boring movie. She said, all these people with Eastern dress, walking up and down, very, very repetitive, very limited.
Ani tigi chela mo karla sonsena samlaya ani karsugureta mi tuzu khu mugo shola mayam go la ya mugi ta shela gang la ya ani nga su tushi tinda yorwa tushi tinda singcha ta ngombo tinda yochu ge ya thnang tinda yong dos ti peti kro shela gang la yang kore ta nga su ge khampa ge yang kore ngula sugura ta tang ge la ya dusia drushas ani ti chilangi kari trba insena ti amalam ro dwez kije trba insra ne karsudus na malam ro mindus lognen ro dus lognen ro dus tela ya khato ko chenchayang do ko guchoyang tang do imbai na ya chigete ya kola ya jala sopa ken kuchim dus nga suge drame ge lognen chigoro kusum sum lognen chigoro drame ge lognen ro dus odis tambala ya te mse and dus lognen ge na ne lognen hachi nyoptu ro dus and te chela muge karsana the mere de suga yang ko sha shokot lote okon sha swa ya do man do che ne ko yang se do ne ko yang chekaran jin ju se ju sha sta ko ya do man do yang se ju tina do tong dos.
So I'll ask a quick question here, and I don't have a multiple choice for this, but I do want you to be able to say, what do you think she means the difference between a dream and a movie? Why did she make a distinction between dream and movie?
Handa tandagi telaya ne damka movie to atena dochi me simban de la trust tang insro ata de ku kaps movie desija bi kaps amalam tang ani alonye yorwa amalam tang alonye ni chegi parola ya movie chapter ti je duwa di chapter de jenu ga jinsen ka de ingire sangudus.
I'd like to hear from the tables. Do you think there is a difference in your opinion between a dream and a movie?
Handa chetsu ge samsi baina ani malam tang alonye ni ga parola ya chapter kare sale sne chetsu ge lens charges.
I think in dreams, like unrelated things comes, you know, in movies, like the story goes by, but in dreams, many unrelated things comes one after one.
Yes, that sounds true. Do we need to translate for the group?
Tanda de lonye imbaina lonye ge kurungi drone chi shi sha de do yores malam nang imbaina dewa mejutina do chigijela chitina tangudus.
But I think an important part of dreams sometimes is you participate in the dream, whereas in the movie, you're just watching it.
That the young chigres, chigres, that none of the something by now, ko young shepherd chigri karidusena, Malam Ganana, Samsumlaya, Korean Grace, and Susu Malam Ganana, you or what a Malam Nona, Chukarichi Chungu, Pasusu, Tin on the Chashilangi or what, Imbana, Lonia Imbana, young Pukaresena, Susu Chashilangi or Maris, Susu, Ye Lonian Tagdik or what.
And she's very clear that it's silent and that this is important. It's just the pictures, not any sound.
Nati mese mogi tela karsigdus na jamindus kusumsun de jazz perna pergi number chumashi jamindus egdus de yankuge ya netan kechambuch chagures.
Okay, let's pick up again.
Of humor, she knew it was a hallucination, but she was frightened. She'd lived 95 years and she'd never had a hallucination before. She said that the hallucinations were unrelated to anything she was thinking or feeling or doing, that they seemed to come on by themselves or disappear. She had no control over them. She said she didn't recognize any of the people or places in the hallucinations, and none of the people or the animals, well, they all seemed oblivious of her. And she didn't know what was going on. She wondered if she was going mad or losing her mind.
That movie kitchen stambala mo karsata choblong yagisugurwata, but the andos. That movie the and tuna imbayan shingdos, imbana motela shake the chance. Mo that lo guchkonga dog, guchkonga partitse par the imbana yang mola ya tunam de do woman chonumandusra. And the movie say like and the tunanti chombi capsi imbana tonga don't is soma caridos and any Mugo ngoma samlu tangu mechu sam mechu ro samlu na khor mechu chi nuwa chong mechu chi nyong mechu ga jwa mechu chang chang tong du sek dus ro ane kurong so chi karsu re na yong go ro chnang de sra na yong tige chi la yang ma pa chan du dus ro timse mogti ga la ya tang jin chi ya ang go mu dus ro mogi tenang ge ta mi tang sa cha tang la so pa ro ane chi mi tang sa cha tang san chen la so pa ane mo la ya chaji mechu ju mechu tender diseguswa ata cheza mo ge tong yus karira uchi chunggu yu meti hapo manduswa ane akarsugure ta cheza mo ge da chi samsila ya mo chi china nyomba chagu yuna nya chi china chi ta chi karsugure tanga su sambade thang thang me pa ge ni ta chi chagu yuna sa me tinda ge mo ge sambe shas.
Bright old lady, perfectly sane. She had no medical problems. She wasn't on any medications which could produce hallucinations, but she was blind. And I then said to her, I think I know what you have. I said, there is a special form of visual hallucination which may go with deteriorating vision or blindness.
Just up to here this time.
Okay. Tatani chela yam ko ge taksi che ba yin swa ani chitang ge moim ba na chi par sugre ta chi report thongbo ro Netiga peti samba peti seu tambo yo chichireshas wa temitse mola ya 지가 맹기테니 초땡기테니 강게티나 요만두스 팀세 모글라 아니 지 트나 제프 지니게 멘틴다 양 사금두스와 아이나 양다 모가레스나 모 데차레스타 무샤 미롱바레스 와 데네 이몰라 카르라이는 나나 당니 초롱라야 지 네탄 카나도 지 잉기요 바티니 하고둘라 바옌스와 아니 테라 양아 소기 통출그 트나라야 통수 다 미지 롱바 차바데라야 네탄텔라 좀비게 통출게 트나 아니 메시지 요리라 바인스와.
Okay, another question time.
That is
Okay. If a patient is blind due to macular degeneration, the deficit is primarily in which part of the visual system? So you will choose your answer, and then you will have to tell me about it.
다다다데 값으로 게디 아니 안가수 색 아니 미기는 게 자시지와 더 냠친지발라 때문에 내바시롱아 차바인바이나 냠친디 수응아수 통솔 말라가 자시 관계나나 정도요레스.
Now you may have to look up and see, check with each other, try and remember your lessons from year 2. But if a patient is blind due to macular degeneration, where is the deficit? What part of the visual system?
야 제소게 데라 다 소데로고 한다게 macular side 어 서티드 냠친라 때문에 데티 아니 롱와 차바이나 아니 거기 냠친디 주 레박 자식 관계로 요레스 지지나 제주다 최대 노름 니바가서 티차버레스타 지주가 타고요 바이나 야나 네 제고요 바이나 야나 제수나 트리드지고요 바이나 다 뭐마 장주 디치텐 제체도로.
And you can take 2 minutes to talk in your group and figure out your answers before you show me.
아니 제수나 콜라야 가만히 기링라야 트리드지 아마 자고나세 아니 되게 제라 양아 주 렌티 카르렌도티 이 팽이지게 인스.
Is it okay to get some answers now?
다시 저 렌디나 되기도 해서.
Yes, they are ready. Yes. Is this going on? No. Okay, yeah. Everyone is ready with the answers.
Yes, let's hear them.
Okay, in 1, 2, 3. Yeah. B. I think, yeah, mostly B.
Mostly B.
Yeah.
Who does not have B?
There are nobody. Everyone is B. Everyone who has the cards are showing B.
Is that your original answer, or did you have to argue with your table mates?
After
당보디는 도 트랜스파이 야나 제수 트리드지데 다 탱크 지지디는 도 인베스.
So after the discussions with the group, yeah, they come up with the B.
Okay, good. Do you want to, so that's fine. Everybody is comfortable with that and I don't need to explain why it's B?
The Tidus, Chetu being by Kenichi to our this Tambala Della, a being which in Sindeshe Magena with us.
Okay, very good. Let us pick up. Oh, where is my, I lost my video. Okay, let's go back. Here we go. And share.
Described, I said, right back in the 18th century by a man called Charles Bonnet. And you have Charles Bonnet syndrome. There's nothing wrong with your brain. There's nothing wrong with your mind. You have Charles Bonnet syndrome. And she was very relieved at this.
So I interrupted after.
Yes.
And then just.
The name is Tilava Insra. The Toma de la ya, any Turep Jujignalaya. And ko Charles Bonnet say Chiki and the Neta di Polaya, and it Tomati and Deshayo Reswa, this Tabalaya, De Laya, Tachela yo pigitachi and Natsamasanachi, Chendicardusena, Charles Bonnet, Tirwakasa, Tanditerishas, this Tabalachonga, Lepala Chumindus, Timsichonga, Sambala Chumindus, Tachola Yobaticardasana, Charles Bonnet, Tanditerindus Lavians.
Okay.
Seriously the matter, and also rather curious. She said, who is this Charles Bonnet? She said, did he have them himself? And she said, tell all the nurses that I have Charles Bonnet syndrome. I'm not crazy, I'm not demented, I have Charles Bonnet syndrome. Well, so I did tell the nurses. Now,
Ani did the Sijans Malaya Muchi Sambati Lera Chachi, Dig Jelaya, Ani Mugan Etantilla, Chinzanda Potanshu, Shanachi, what in the Mepachi, what is Tambalaya, Nimuchi Yansembo on it. That Cartridus and Charles Bonnet said the series. Mola Yatanditi Chombarways, Netan the Chombarways. Ani Tigela Mukala Sonsena. Ani Chorangi Manshepa Samalaya, Ningala de Charles Bonnet to Chilavochis, Ninga Yombari Meduswa, Nanga Chigianchi Tempa Jeg in it on the Duchon at the Medus, Nanga Yoba de Aneko Charles Bonnet on the Teresha, Teres, Tambalaya, Ane Tandata, Amjitri Aramoni, Banakari Insina, Netanti, and Manshepa Samala Desijavins.
Okay. No, I moved too fast. Yeah, right.
Homes, largely, I see a lot of elderly people who are hearing impaired or visually impaired. About 10% of the hearing impaired people get musical hallucinations. And about 10% of the visually impaired people get visual hallucinations. You don't have to be completely blind, only sufficiently impaired.
That the by night and the Chalaya, Nathan Ala Chita, Chitanga Nathan Chagdu, Swa, and against su continent Lekachi, so Gansu continent Lekachi, Swa, Ninga by na, me to a Carsogreta, a Jimmy Chinchiwata, and Anjok Chinchiwara, it's sort of Consola Chinchua meet the Stonium the Chies, Chergin by na. And I'm joke that you to it certain like Junshu New May Nanija choose like Yakusolata to certain debiro, Nidika Coge, Royantam Devi get to nothing that you rest them say, and it's me like Chunchi mean by Naya, taken on age as she choose like Yanko to certain Devi to not the Chungu rest, take up Tangazu Lomba system, but the Michata Lomba Tindaingu Maris, Chiamato Tindaingu Marista. Mila ya Nyamkin Chongate that you take on Chinch Chomba and Curious.
18th century, Charles Bonnet did not have them. His grandfather had these hallucinations. His grandfather was a magistrate, an elderly man. He'd had cataract surgery. His vision was pretty poor. And in 1759, he described to his grandson various things he was seeing.
Handa tanda degi ko chlu tat tirip choche na na ya ko mi gi deshi na na kare choes na just bone korang la ya degi tandi di pa chi ma res korang ge popola wa pola ne tunon dina do chung de shas ko ge pola te ro wa ane nga su chimpanzee ba ta mi gemba chi ra wa ti tamba ko ge mi nga su mi gi cataract surgery na mi ki pa pa ti ko ya chi wa te ge cha ji tian chi shas because ko ge da 미기 다치 통나치 왔다 하창 주고래 두스 아니 거기에 직동 dinja랑 같이 나글로라야 아니 거기에다 차우 참모술라와 차우라 거기 차우라야 아니 그런 게 지금 잠이라 통주근이 던던 시작도스
Midair. It was a large blue handkerchief with 4 orange circles, and he knew it was a hallucination. You don't have handkerchiefs in midair. And then he saw a big wheel in midair. But sometimes he wasn't sure whether he was hallucinating or not, because the hallucinations would fit in the context of the visions. So on one occasion, when his granddaughters were visiting him, he said, "And who are these handsome young men with you?"
그런 게 대시다 보고라 대시자 그런 보라 대시자 계속 그런 게 담보 통화대 같을라나 같이 다 나가리로 왔다 아주 진짜로 지가 그 반응하러 통과도 스토너면서 아니 그 강라야 아니 가서 그래 때 아주도스 다 나가리로 와라리데 그 천자 응원부지 아니 대 강라야 아니 지금 가서 살막은 도와 인조기 아니 고르고르티나 인조 도스 Nistambala koge te chuna imba haku yores karchila baina pranang la ya kolari na chi achotena ro chi degi mariswa ane tegi jela koge ane chi yang pranang la ya kholu chembu chi bang thong sa swa cham la ya ina yang da cham la koge chi jongwa de yang chuna yin me yang haku mandus karchila baina chuna chongjo de ane nga su ge thonang ge ne tang la ya ta da ko cham ba ro tin da yang dus ne tang chi ge kap su koge da chamo 참모 가지고라야 두스타 다가용 스탐발라야 그 가린데 시지야송스나 알레 디게다 나츠가 퍼센트 구스고라 퍼센트 구 쳇스토냐 뼈 퍼센트 구 디즈 시리즈 기자트송스
Some young men disappeared. It's typical of these hallucinations that they may come in a flash and disappear in a flash. They don't usually fade in and out. They're rather sudden and they change suddenly.
Can you go a little bit back because it looked like 625. I think that I didn't hear at the beginning.
Ask Grandpapa, there are no handsome young men, and then the handsome young men disappeared. It's typical of these hallucinations that they may come in a flash and disappear in a flash. They don't usually fade in and out. They're rather sudden and they change suddenly.
Tataneta koge samutsuka pola roa ale pola tela ya ni posel zukudinda yo malis tida lavata ani tandagi koge thombe ge posel zukusura tetam pete mapacha sonswa ni chetangi imbaina ngasu chunong ti chongwi ge kapse chuge nawade ko ta chuzamla yongchi chuzamla lawdwa tinda des kosu yang karsugure 지금 렘신등의 영화 렘신드 라브에 들어도 요 말이었어. 그 터적 로봇 터적라와 로봇 터적라야 그저 종아테레스 는 주로한테요 로봇 터적라 중그레스.
Grandfather saw hundreds of different figures, different landscapes of all sorts. On one occasion, he saw a man in a bathrobe smoking a pipe and realized it was himself. That was the only figure he recognized. On one occasion, when he was walking the streets of Paris, he saw, this was real, a scaffolding, but when he got back home, he saw a miniature of the scaffolding 6 inches high on his study table. This repetition of perception is sometimes called palinopsis.
That Tomachila yat and the Kogi and that Trinity Parliament Charles Lulin, what Kogi that a Pola Tigmila Charles Lunin, and a Kogita Pete, I yipped in that Jatamam put in the drum, the Jatamam put in the tournament, 아니 가츠게 예중기 안나서요 배 단드라 만다들 통です근데 타마치라야 거기에 다 미치그와 아니 가서 주쿠트누 지라 거야게 지글로스와 티건도네 타마치 통데 바지 그거 통샤스와 아니 티 거기에 아니 그게 티 코로나인 바와 볼라 코로나인 바 아니 지라하고 샤스 아니 티게 나네 그거 다 지트나 지위게 나네 아니 그런 거 무시 주디 미티치 보레샤스와 아니 타마치라야 아니 그 카르사나 그 단다겠다 페리스 글람칼러 드스탐발라야 디네 그 가리 통샤스나 단디 문이를 들어와 문이 가리 통요레스나 스케어폴딩스나 가서 감바드네 드스탐발라야 아니 가서 게 티치즈고도 기섬스리앙 그래 줄로라야 그래다 게도야 드기치 강라야 조야기 치도 어디나 도치 통요레스와 티 문이 통바레스 이만에 그 제라 그 나라 로노 제라야 아니 코랑기 다 지금 스테이지보다 그런 걸 좀 지사가 독색이 강라야 아니 그런 게 단다 페리스기 되니 돈주기 된다로 총총 인치기 지와지 그런 거 독색 강라요 주된다 통샤스 데스탐발라야 아니 데라야 단다 되게 되라로 아니 가서 드시대 양 체스 중에 지도가 데라야 아니 지금 드시대 다우디 양 체스 중에서 그거레스
With him and with Rosalie, what seems to be going on, and Rosalie said what's going on, and I said that as you lose vision, as the visual parts of the brain are no longer getting any input, they become hyperactive and excitable, and they start to fire spontaneously, and you start to see things. The things you see can be very complicated indeed.
다단다 폴라데 타타 로즈레 타윈바나 코츠게 코츠라타 가리충구 요레세나 다데 갑심바다라슬레타 문이 가리충구 요나스 두스탕게 가르세게 마이나 달라베세나 아니 조랑게 티 카르사타 미기 통솔티 냠바다 아니 조랑게 레피기나나요 유튜브에 아니 가르서그래 레피기 나나 유튜브에 단다 통솔탄 데비기 차시데라야 아니 고 나온지그 차튼디네 라구요 말와 틴스탄발라 코스 페테다 첼리 게비게 정보다 아니 페테크로 전부 차고요 틴스탄발라야 코스게 페테다 티냠트다 땅가 속에 조아지기요 바로다 데코게다 다티 타에게 니탄트 정고 틴스탄발라 티게 갑텔라 아니 저런 게다 자반 담다티네 통고요 다티 갑스 아니 통웨게 자라대야 아니 모니터네 임바네 참삼라야 하정 옆다 사우티네 잉그리스.
Okay. So at the beginning of his talk, Oliver Sacks said, we see with the eyes what we also see with our brains.
다단다 데 값스 담보 데라 고게 담시된 고즈비 값스 갈세선사나 가수 미키 자라 통고요레스와 엔티 제라야 가수 레파게야 자라 정리된 통고요레스 랍선스.
So here what's going on is the eyes or the sense organ isn't working very well, but the brain is still acting as if it is receiving input.
단단데 값스데라야 가수 통출고 왕포치고라다 메기나니 네코가 통출 왕포티게 레카치기요 마디스 니마나 가수 레피나나 요피 통출고 차시되게 아니 콜라 지차틴 조르바 나징게야 레카치기요레스.
So the parts of the brain that would normally receive visual input, in the absence of that input, they start to just fire.
다단데 값으로 실게 바나 가수게다 미키나니 방크레다 치탕군 조사게 레페기 차시치 토만 조사치고로와 어때 네 단단데 값은 가수게다 미그 왕보텔라 춘지비 값이나 네코게다 다데 차튼팅 와요 말와 차튼 와 메바이 값인 바나 그 베트크로다 정보다 전부 차요레스.
Let's hear from Dr. Sacks.
With another patient of mine who also had some vision, the vision she had could be disturbing. On one occasion, she said she saw a man in a striped shirt in a restaurant, and he turned round and then he divided into 6 figures in striped shirts who started walking towards her, and then the 6 figures came together like a concertina. Once when she was driving, or rather her husband was driving, the road divided into 4, and she felt herself going simultaneously up 4 roads.
shenda chi mo ko ge ne pa shenda chi la ya ko la ane chi yang tongso ge chna shenda chi ri shenda chi chung du sti kap se chong me se tiang pe te kar su ge ta tis ta ma de wa tin da des ta ne ta chi kap se kar su se na mo ta mi chi ge gang la ya ta kar su ge tu lo ko gang la ya ta stripe system bala ya nga su ge cha shi yo wa tin na mu ge cha ri sa cha ti yo sa cha ri ge ti tin da yo sa wa o te do mi chi ge ani kar su ge ani de la sa kan chi na de sha sa no ra ne ko so yong de ta ani ka tsu lo yong stam bala ya mi te kro na de lo ta ran kon mi chi pa chi chan tu la ya du sa jin ru du swa ani ya te che la ya tu sa ma mi chi lan jin ru du swa dinner reshas ane thamachila ya mo ta moda ta mo choka ga moda ta persa kare ngudu sana cham la ya ane lamka ti kro lamka shila chi do ya ta ane mora ya pete kro ti chi la lamka jichag na ta lu yo pa ga so ta le dus
mobile hallucinations as well. A lot of them had to do with a car. Sometimes she would see a teenage boy sitting on the hood of the car. He was very tenacious and he moved rather gracefully when the car turned. And then when they came to a stop, the boy would do a sudden vertical takeoff 100 foot in the air and then disappear.
ta mola ye ba de ka de sena nga so gucho ge wata gucho ge tnong de da res ro gucho ge tnong de nang go res ro ma chi shi ta de tnong de ta ne lang khor tang de chi chi re sha so ani thamba chi la ye cham sala mo ga thong do sena bu ge chi ro bu ge ta lo chi tang na ma yu bu ge chi mo ta ge da lo de la ya gang la ya de chi de ro inte me se ko pe de ko ra chi dambu ga ne de ba kang shi la ane motan gucho thang stambala ya ane ko tan ba ko pete ko ta ka den ho shu pa ya man go ti de chi de sha sra ena ya ta mota te ko ta ko gucho tang ya cham sha stambala ya ane lower te ro ko de ane ko parna la yang ko fit jan da uti na do chi pete parna la yang ko re chi predo de ane ma pa cha do dus.
Okay, time for another question.
Ta to jen ba chi is
A or B? Oliver Sacks gives very detailed descriptions. True or false?
ta danda de la Oliver ge nga su ge de she ship thanang songs it jure no res
Okay, it's mostly A, but there are a few B's.
Oh, who says B?
And B language to that. B language to that. She gave it. B Harjin line.
B खर्चेला ना मोग कहाँ लावा दे माजिश मातो लेबा ना ला खर ड्रोगे में जिनसे खर करें बस बस ते बस चुमा सोस.
okay yeah he just explained what are the patient's experience or what they described about that things but at the moment he didn't explain what is really going on in their brain or mind. He didn't give any detailed description about those stuff.
So he gives the detailed description of what is happening, so the clinical presentation, and then we will learn about the mechanism. But he's telling us about white handkerchiefs in the air and scaffoldings and boys sitting on cars. That's a lot of detail. So when you tell stories like that, it keeps your audience interested to find out more. So I could save now a lot of translation and just say, if your eyes aren't working, your brain can still fire.
Dawala kugi jirate chinywa ta chetero kete chano mikile ka chigme pa imbana ya tetan revi le pa na ne tando da tangre la na decoris.
Their question?
Yes.
Yes.
Again, the digit goes on standard the never tangbojita. Big tola drama to Miki Tonzo the Dereki relation the tola drama. Any the Mik tola drama in a da the input chigaro. Nanzo the camera dinde bejo tanze electrical impulse tata chitrevaina. And the cooking Nanzo get Tongana and Tong to reverse.
For the first patient, there is a question about the first patient because the only the I think is macular degeneration, only that one, and all the other part are intact. So his question is if we can use input, visual input like a camera or some kind of machines that we can, if we can put a visual input, will she able to see things?
Yeah, so that is a really great question and an interesting theoretical proposal. So yes, in theory, if we're able to bypass the eyes and communicate directly with the visual cortex, yes, you could generate images. So for the visual system, the research and the neurotechnology has not advanced that far yet. But for the auditory system, there are things called cochlear implants that attempt to do exactly that. So these cochlear implants will take sound information from the environment and transduce it, change it into a form that the brain can understand. And Andy, correct me if I'm wrong, but they are trying to do some things like this with the visual system, but I think it's only at the level of color and and motion. I don't think they've been able to create a full image. Is that correct?
That's right. I think it's very pixelated.
Yeah. But your research proposal is exactly what scientists are working on. Okay, I want to hear a little more from Dr. Sachs. There are a few more questions that I have for you. So let us pick up.
Of mine had a different sort of hallucination. This was a woman who didn't have trouble with her eyes, but the visual parts of her brain, a little tumor in the occipital cortex. And above all, she would see cartoons. And these cartoons would be transparent and would cover half the visual field like a screen. And especially she saw cartoons of Kermit the Frog.
Miki tachi thoya la ya kangi yo ma de simba na ya mutang de we gita tonsol gi lepa gi na la ya chashi chong res ka chila na dan dang su tondek bana la wa tondek bana la ya ani 10 chin chin chila yo res wa da ti kap se ani mo gi thoya ti chunong thoya ti kari thongo re se na nga su gita cartoon wa gurji to ya na gunye gurji ti na thongo yo res wa ani gurji thoya ti zo yang ko chise na se ba ka shila mo gi ane chinga tsuge miki migra yora ta miki miglam ga cheka chi kapshak dus nga tsuge yowa nangshin kapshak dus ane thama chikala ya mikse ge ane moga kari thongsha se na ane ngurri imba kanshila Kermit sikdwa beba ta beba Kermit se tege ya ngurri chik thongsong sikdus.
Now, I don't watch Sesame Street, but she made a point of saying, why Kermit? She said, Kermit the Frog means nothing to me. You know, I mean, I was wondering about Freudian determinants. Why Kermit? Kermit the Frog means nothing to me. She didn't mind the cartoons too much, but what did disturb her was she got very persistent images or hallucinations of faces. And as with Rosalie, the faces were often deformed with very large teeth or very large eyes. And these frightened her. Well, what is going on with these people? As a physician, I have to try and define what's going on and to reassure people, especially to reassure them that they're not going insane.
That Kermit on Sakura, that take up in Bana Tangara in Bana, Sesame Street set to Tagames, Bana Tata, and then move like Dusena. Kermit said the college in a sig the Shasra, and the Kermit sig a Bewa Kermit said the nine banner to 20 times to the game which you mean Uswa. Tangi Tidado Chita ko the touching with the Florence or touching the Karim Bana, and a movie that touching so that they capsi Bana, so the movie Kermit Ganta Shushi, that Bewa Kermit said in Alas when I came which Maris. And we chitang in by na chi gunyen tongwa la ya chi ko ga samjuk shita chi mdu sim by na ya chi karsugure mola ya ne karsugute shenda gi ta nyen ta yang na mi tongpa dang te na ro tong yo wa o tzu gi yang chi karsugure ta mola testa madwa ro zo sha de rosle tong chongwa ne tongwa gi ane chi tongpa tzu in by na chi tongpa chok chok ta to me ba dang 아니 가서 그래 지 수천 보여 받아 양나 미천 보여 봐와 어디라로 통샤스 데이터게 아니 데네데테 몰라 나타치샤스 아니 다 맨데달라 가리 중고요리 사바이나 나가라 지금 멤버 지금 비차니 나랑게 아니 고솔라야 가리 연구요 받에 반드시자 아니 때문에 아니 가서 그래 아 고솔라야 가리지 임바 터치고레스나 고솔다 지금 연바 차가 매비게니 tanto 고솔라 베트부터 이치 당배 부는 고솔라야 데시자고요레스
As I said, of visually impaired people get these, but no more than 1% of the people acknowledge them because they're afraid they will be seen as insane or something. And if they do mention them to their own doctors, they may be misdiagnosed. In particular,
ni tangi shebana shintanga suge tela ya karela biore sena chitangi migla chunche wi na ni mi ja che chus ke de do thongare seguyo simba na ya ngala tira do chu do se ni do kelanchi ni ja che chiz mashmin do jinsen karchila pa imba na tira do chi desija pa imba na chi nyomban do la thoya ta ana ta shenda tira do munjin chi anya kayo res ni ke de susuga amjila ya member tira do chi desija pa imba na amjige da na sa ti motor choya te ni na sa gi motor norwa choya gi nya kayo res.
notion is that if you see things or hear things, you're going mad. But the psychotic hallucinations are quite different. Psychotic hallucinations, whether they're visual or vocal, they address you, they accuse you, they seduce you, they humiliate you, they jeer at you. You interact with them. There is none of this quality of being addressed with the Charles Bonnet hallucinations. There is a film, you're seeing a film which had nothing to do with you. Well, that's how people.
집단 샤바이 바나가 수기 지금 다치 통야도 또 퇴야도 연구하러 되나도 임바이나 지금 연바 차주기 지금 되나 사매들어 여러 네탄데 요리스 등시 임바이나 수기 psychotic hallucinations 도 왔다 가수 삼칸 투파기 트나운데나도 임바이나 양테 네탄 셴다 지리스 단다 삼칸 투비기 트는 거 값이 임바이나 다 메라야 지 통야도 또 고야도 또 되나 연구하러 이나 값이 임바이나 다 only tela ya me chika katanga yoba do ta chika mani khao chika yoba ta chika sugre ta tugu yoba antimse karsugre me tela ya nyachu chika yoba a theda do ge mse ane ko karsugre chali chika yoba ge ne tante ngo resta de kapsi baina ane ta tanda ge tuna te kapsa ta tuna chiki chini ge ta me da karim baina te ta la susu pankurin jawa chi de te kichi chika yoba ge ane tante ngo res ane 단다기 단다 Charles Bonnet hallucinations 거 Charles Bonnet 트난기 담디디라 게 아니 나라야 네 단다 데라야 나서 삼근 투비게 트난기 제치두게 구치 미두스 아니 카스 피샤샤나다 데라게 때처럼 가 로년치라 타고 바이마이나 아니 로년 때 아니 저라야 지금 카스부터 조요 마찬 거 로년티라 타데기 레스타야 메기 양 디기텔라 고알렌터 트레다고 치레스.
Okay, another question time. We want to know, can the visual hallucinations of Bonnet syndrome, as Dr. Sachs describes, can you differentiate them from psychotic hallucinations?
That dramatic address and amjit and the member Oliver Gideshijabi and the Bonnet Tanduchi or Bonnet Tanditi. Bonnet Tandu said it, and the Imbanga Sutino or Bonnet Tandu to the song Gitanantirua. Dede, then is some country big Tonsutinantiora, then a chaplain jet credit maris.
Okay, so decide if your answer is A, B, C, or D. Talk at your table a little bit, and then let us see which one you agree on.
That is not to do your chess, any air the beat the series the dear those, any to the chiding as well the current Tagians.
Slide it chirtano Tongmudukuchi.
Can you enlarge the slide? Maybe you can just
Put in full in presentation mode.
Yeah, slideshow, and I can read.
Yeah, let's see. Let's try.
Did you know which address that? Tambote a jet Kamaris, Matus, and Nita Niga Nala, Chano, Ko Yonche Gun and Jutochin, that things Tambala and Jutochin, Jurandu Yetsanwa, the Chapajet Kamaris, Beatila Chapajet Kamaris, and you could pronounce it, you could maybe in the key is this Tambalaya, Kolaya Chapajet Yomaris. That's sitting by na. Ko cheba jet grace the second to pick a good not in manner chapter John's chamber music Nepala yam grace music shayres no bonnet on the good in a maris sidwa a date ko grace bonnet on the good not and susumila chamba in by name could sometimes chiton at Tonyang Yopatinaris and a second to pick it not teach it on the maris.
That's somewhat today, no? Okay, Jillian, I think, yeah, all the groups are ready for answers.
Okay.
So in 1, 2, 3. Okay. I see all C.
All C? No one said anything else.
C me wa ani shimba yo A, B, D.
Nothing.
Only C is I see.
Very good. Do you have any questions about this or clarification?
Look like really clear.
Right?
Oh yeah.
Okay, very good. So let's listen a little more, see what else we can learn. Did we know all this information before, or are we learning something from Oliver Sacks?
Te netan tzu chezo ngoma shi ju tinda imbe tanda nga su ta Oliver ge te she tanda tamshi di la tende de ta sawa shi ju tinda re sa. Lanchi chanda ya.
Sava is.
Yes, new.
Okay.
Sarva sarchoin.
Fresh.
All right, let's pick up.
A thing called temporal lobe epilepsy. And sometimes if one has this, one may feel oneself transported back to a time and place in the past. You're at a particular road junction, you smell chestnuts roasting, you hear the traffic, all the senses were involved, and you're waiting for your girl. And it's that Tuesday evening back in 1982. And the temporal lobe hallucinations are all sense hallucinations, full of feeling, full of familiarity, located in space and time, coherent, dramatic. The Charles Bonnet ones are quite different.
Ta de la ya yang xian da ji dan da nga su ge de le wa na tong da ma ge ta je rang su ge je su ge wa. Ta te se ge yang ko ji yo re so ta te ge jab ser ti ta yo ba yin ba na ro wa ne tan de yo pi ka sa ani mi ge kari chit kre se na su su pe to kro ta tan de be ge tui chi la ya ani yang che chlo chi de ti ro wa chlo chi ani chlo chi mi che saja chi dang ta tui tang saja ro wa o chi la ya chlo chi de ani picha sha na chorang ta saja ta lam gi ta lam du su ro lam do ni chen chi la yo pa ta ani chorang ge te la ya ka ta chestnut sa gi da ti ko ta ga gri te ngu yu pa ge tma zu ken chi ya a so ya ani ti na shin gi ani chi min kho la so su ro da te la yo chu gi ta min kho la so pa ta ta chu kho la so pa lang kho la so pa ru gu yo chu gi and ge te ya so kwa dem se de kap sim ba na ta da ne ne tong de la ya su su gi ta ma chu go wang chu cha ma de gi yo es dem se ti kap se chorang ge ta ga la gu de gi pa ne ta da te ya ani ka se chu chi tong ge ja ra ja chi cha ni lo ge za mi mar ge gong chu chi ba wa ma da ti kap sim ba na nga chu ga na tong da ma ge ani trinang ti chong wi ba na nga chu ge ta wang chu cha ma na de gi yo es dem se te la ya chro yu pa ta ni su su la cha ju yu pa ani tim se ani ko karsu de tanga suge ne dang tu ni cha ni je yin ba ta ta yin ba tin na shin ge ko dramatic system ba la ya ani ko karsu de ta ko de la ya ani ju ni nyong ge ran shin tang den ba ma tin da chi res de kap se ani karsu de Charles Bonnet ge ta de chu ya wa de yang de tang pe de ko chapter chimpo de res.
So if you're using something like this in your classes, you will have more time. And this is taking a little long, and I do want to ask some more questions, but here would be a good point for a conversation or a discussion about what makes the temporal lobe epilepsy hallucinations different. What makes them full of feeling? Why are they all sense hallucinations? That's very different from the Charles Bonnet symptoms.
Da da chubdi jima la chesu tira dawo te chesu zinda na trevi yo pa na chizu khomba yo za ani yan chesu ga tanda imba na ngasu chizu mdu sirwa mambo ragu yo marwa ni jela zinda na trevi kap si chesu la chizu mambo yo sen te yang pecho tanga tenda yo reswa dan digi kap te la ya tanda ngasu ga naptong dema gi japsip te chong wa imba na rwa naptong dema gi japsip te chong wi gi tuna imba na te la ya be te kurata nga chu chroa tang demba nyong chu tang demba tim chege wang chur gi karsa gureta nang gi chatin chang ma yobe gi ne ta chi yorwa te 아니 수단다 샤스 보내기 당디 당데비기 트나치요와 데이터 만도 임바 당 간다스 만도 임바기 네탄텔라야 아니 진다나미 프리드치기치나 그거레스.
So we'll go on and get one more set of questions because I know we have break soon.
다다다 가서 저거 personality 도 심바팅엔들라 가서게 저 딘신치고 투부제 차스당인스.
These Charles Bonnet hallucinations, you have all sorts of level, from the geometrical hallucinations, the pink and blue squares the woman had, up to quite elaborate hallucinations with figures and especially faces. Faces, and sometimes deformed faces, are the single commonest thing in these hallucinations. And one of the second commonest is cartoons. So
다다다가 저 찰스 보네기 트난디 값에 저런 게 다텔라 양 름반 드라마다 있어와 다른 바이오 바치기 당 보땡가 수가 입기 되니 이게 트난 정화당 아니 팀세 가수 전착이 되니로와 니 진짜 당 다 입기 되니세나 데라고 보모 프로메티 같은 거래서나 아니 주시되는 통고여와 진짜 당 아니 몸부인주 주시되는 통고여와 아니 고양 대시양 고타 제보된 인사 아니 가서 그래게 아이앱당 아니 동바된다 통야 아니 동바야 지금 동바가 이 줄때 바로 어디나로 동거리스다 단다게 동바니 만에 단다게 니 단디 값으로와 주는디기 리디 값에 아니 지금 그다 트몬트 요바티 동바 통고 요바티 그 지지 아니 양지 되게 올라야 다 지금 현대가 됐으나 양아 속에 구리기리 통요레스.
what is going on? Fascinatingly, in the last few years, it's been possible to do functional brain imagery, to do fMRI on people as they are hallucinating. And in fact, to find that different parts of the visual brain are activated as they are hallucinating. When people have these simple geometrical hallucinations, the primary visual cortex is activated. This is the part of the brain which perceives edges and patterns. You don't form images with your primary visual cortex.
돈 뉴스 가리중 거래에서 바이나 아니 데비게로 카치나라야 아니가 속에 단다기 젤리기도 퍼지오로 티페지 당데테 미기나라야 트노치비 값스 자파노네 파티 제요레스 티값스 고속에 네 가리 통어레스나 가서 통적을 레피기 자시만라 와로다 단다 트노치비 값스 자시만라 만라 딘단도 아니 살론 지요부터 통샤스 비차샤나 미기다 답 데비기가 임 당 레비기 트넌티 총이 가신 바나 소데나 수게 아니 통솔레션 토미 통솔레션 치거와 어디 강라야 아니 primary visual cortex으로 통솔 엉엉기 레션 치거와 어디 아니 살롱치샤스로 아니 안티카르 탄데오요레스나 아니 가수게 지금 잘라임바이나 되게 지가 이앱당 되게 술당 yana 동디 통야당 안되어요레스 근데 인스탄발라야 단다게 레피기 자신들라야 아니 통술기 나름의 신디게 나라야 아니 가수가 리무트당 퍼치거로 이미지로 아이 리무트 조금마레스.
One more question.
George, yes.
Easy one. Very quick.
Yes.
Very quick. In which You're muted.
Ale.
Yes.
Yes, the answer is A.
A. Very good. This question is just to make sure that you're still paying attention because we've been doing this for a long time. But if you were teaching this in your own classes, it would be an opportunity to have another discussion about the differences between the different parts of the visual brain.
tek yang zenda TV kapsir wa nga sugi ta tongsul malaro tongsul malo tan jo yu pigi lepi chashi mando ko la yang industry de jigi ko ke ta ba te tu ba na ya yoris.
Okay, a little bit more.
A higher part of the visual cortex is involved in the temporal lobe. And in particular, one area of the temporal lobe is called the fusiform gyrus. And it's known that if people have damage in the fusiform gyrus, they may lose the ability to recognize faces. But if there's an abnormal activity in the fusiform gyrus, they may hallucinate faces. And this is exactly what you find in some of these people. There's an area in the anterior part of this gyrus where teeth and eyes are represented. And that part of the gyrus is activated when people get the deformed hallucinations.
Nga suge nangyen chi ora image nangyen de nga suge tonsor leshin gi ani chi ko ge chama sona the tua chi la chashi tua chi la chago yores ro te ka res na nga suga na tong da ma ga na la chi yores wa tin na ne hapor to na tong da ma ga na ne ne da nga suge phye si ji sig do ta da pu ze pu ja res do wa o te ta do yo pa chi res wa Pichashana Keti Migi Tandaki Paya Siju la ya Chun Shopa Imbaina Nekotsugi Migi Mutochoya Migi Mushia la ya Motela ya Mushi Nipati Nyamdu Yoris Imbaina Yang Keti Tandaki Ani Panyebugi Siju se Tigana la ya Nichiga the Jundan Maimbi Chikutin Chomba Imbaina Ani Day Latin de and in don't buy tree, don't buy on day with Trinonti Chong Yoreswa, and this Tambalay, and the main data on like Tong is in the Chong de Shaswa. Tim say, and it and Atsugi, Siju Tigi, Nin Dengugi Chashi de la ya, and a Karsugre, Dako, Langasugim, Sotan Michambu or Suchambu to Michambu again, and a Chashitan de Odusra, and a Karsugre. That Chashi Yeta. Any meat is the meat is la ya, and it's you meat chamber down, so chamber you get to not in the jungle cups, Kutsugi Tandage, and a Siju dig, or I used to jig in the Migichashi this along Chishas.
Okay, one more question very quickly. Oh, and there we go. This is the one, Dawa, you can translate live, please.
Recognize Kedi Chonga Dompachi Tongu Batayana, and Nikas Mutachi Tongu Yobati, Kangana Chishasana, Asuge, Mubo Minjinjia Segwarwa, object recognition, Mubo Minjinjia Setina Laya, Eshijakshas. And Kesang Atsun Zemdagnani Roa, again Jeremy in the Registambala, Atsu Dompalonga, Mu Marshuachora, first point. Getting Atsuge a point GT Lachinjo Bambana, Mushiagini Tanti, Chungris and Dishijasas, did that the Trachi means in Kalda Baina, did Tandagi, de Tagatagi Young Kesangatela, the Nekarsugre, and Jawatri Cheti, Yensene, Kesang Atsuge, and a Tipola, that you Muchumo was a mucho first blind Sibarwa, Tigola Tridici to Jangadue Esa.
Yes, do you remember yesterday? True or false?
This time it's, I think, 50-50.
So yesterday, when Jeremy was showing you the different parts of the brain, I was paying attention because I know he was talking about the face blindness and the fusiform gyrus.
The case, Jeremy is a trip of singing to not a pines, cooking as a Tandaki Pony Sijita, and a moo maturity or a mooshi at the church or deep on the Sijasons.
So I don't have his slides to show you, but I definitely remember him going over this area and this gyrus and talking about where it would be that someone would have trouble with faces.
Tanda kesan tenju ke parti mindu simbana pugele pege chashitan laparta tanda siju ditende tande la ya chonchong ba bana chi dompa nguma shia de netante yo pa de jasons.
Okay, I'm going to very quickly, I know we need to break, but I just want to play this one last section.
70, it was found that there were not only parts of the brain, but particular cells, face cells, were discovered around 1970. And now we know that there are hundreds of other sorts of cells, which can be very, very specific. So you may not only have car cells, you may have Aston Martin cells.
That's which don't be jera dinchige yundela yang asoge kasugre. And asoge kasugre. Lepig chashi zem member ye, any lepig na yang tapon may go away. That we say check out in the YouTube is species and as we don't bug tapon so the nete don't bug fast cells, the don't bug tapon. Let the lepin on is to go to the right. They don't jera dinching on a new but the senator race. Let him say picking as well as tapon didn't with Jatomon Parwa. She is the Kosu bet the shita and Mushia getting there what happened in that. And here, Jelaya, the Mutagi tapon, so a muta wishi with tapon in the same say, and then the Astromarin says that means what team Mushia get tapon you is.
So what I want you to think about is as you're teaching, you could actually find the paper, the research article that was published around 1970 that talks about discovering these face cells.
That's a concentrate because much Tunguja than Chigi and Delaya, and it and I get fast says, or don't get up on says, what did this a new chong we forget any Casagre, Jetum Chishajuti, and it's an adequate.
And you can give your students the opportunity to study these things so they can make the connections.
And it is the Putula Teta Casagre. Lobjon Chigro to the Kagitalo Chigi, the Tonku Parola and Jawad's Gashora, or the Chikin at Police.
So this is an 18-minute video, so there's maybe 4 minutes left. There are some other learning issues in there, but I'm going to stop because it really is just a model for you to see how you can use something.
So the Dela Yashigana come Joji Shasti, all I Yashinda Yanko and catching the Shijas. That under they do stand it so the Chesula Yanchi person, Lobjon Chiata, Hampton Chiagi, Chiganko, Chataton Chita, Chimba, Chitins.
I expect that you have some questions about what we've just covered, but I will take them at the beginning of second session, right before Andy starts to give his presentation.
That gets a draw you get a by now as to anybody good to what natural language.
Okay, so I will say, enjoy your break, and I'll see you back in half an hour.